Every 40 seconds, someone suffers a stroke or a heart attack. Yes, while you're watching this, another life may be at risk. But here's what most people don't know. Your body often warns you weeks in advance. In this video, we'll show you 8 early warning signs that could help you avoid a heart attack, prevent stroke, and even save your life. Plus, you'll get practical tips and drug-free solutions to protect your heart. Don't wait for the emergency. Let's start now. Many people confuse stroke with a heart attack, and it's easy to see why. Both are sudden, life-threatening events, and both are caused by blocked blood flow. But here's the key difference. A stroke happens when blood flow to the brain is interrupted by a clot or bleeding. A heart attack happens when blood flow to the heart is blocked, usually by a clot in the coronary arteries. While they affect different organs, they share similar warning signs and risk factors: high blood pressure, diabetes, high cholesterol, smoking, stress. That's why understanding the early signs of both is critical, because if you miss them, it may be too late. The first warning sign is a headache that feels different from what you're used to. It may come on suddenly or build up slowly over days. Unlike a normal tension headache, this one may feel deeper, sharper, or located in one specific spot. Some people describe it as a bursting or pressure pain, especially if it's combined with nausea or vision changes. This may indicate reduced blood flow to the brain, or even a small brain bleed. If your headache feels off, don't wait. Get it checked immediately. If you suddenly feel numbness or weakness in your face, arm, or leg, especially on one side, this could be a mini stroke or full stroke in progress. It might start as a tingling feeling or a sudden loss of strength in your hand or foot. You may drop objects or have difficulty lifting your arm. These symptoms often go away within minutes, but that doesn't mean it's safe. This could be your first and only warning. Call emergency services right away. Blurred vision, double vision, or even brief loss of vision in one eye can be a warning sign of stroke. It happens when blood flow to the visual areas of the brain is reduced. Some people think they just need new glasses, but sudden vision changes, especially if it happens in just one eye, must be taken seriously. Don't delay seeing a doctor. Suddenly slurring your words or having trouble understanding others can indicate a brain problem. This happens when stroke affects the language center of the brain. You might speak slower, forget common words, or say things that don't make sense. If a loved one seems confused or not themselves, ask them to repeat a simple sentence. If their speech is off, get help immediately. If someone suddenly walks as if they're drunk, swaying, stumbling, or unable to keep balance, that's a red flag. This could happen without alcohol or any other reason. It's often due to a blockage in the brain area that controls movement and balance. Some people feel dizzy or have difficulty standing up straight. It may last only minutes, but it must be taken seriously. Stroke symptoms don't always cause pain, but they can be deadly if ignored. Feeling tired is normal after a long day. But if you're suddenly exhausted for no reason, it could be more than just fatigue. Many stroke and heart attack survivors report feeling unusually drained days or weeks before the event. Your body may be struggling to deliver enough oxygen to vital organs. If you feel off, tired, heavy, or weak without explanation, pay attention. Fatigue may be your body's cry for help. Chest pain is the classic sign of a heart attack. It may feel like pressure, squeezing, or heaviness in the center of your chest. The pain might spread to your shoulder, left arm, neck, or even jaw. Some people describe it as a weight sitting on their chest. If it lasts more than a few minutes or comes and goes, don't wait. Call emergency services right away. Time is muscle, and minutes can save your heart. Shortness of breath that comes suddenly, especially with little effort, is a warning. It may feel like you can't catch your breath, even when resting. Some people also feel fluttering in the chest or rapid heartbeat. This could signal heart rhythm issues like atrial fibrillation, which increases stroke risk. If breathing becomes difficult without explanation or your heart feels like it's racing, take it seriously. This is not just anxiety. It could be your heart asking for help. Too much salt increases blood pressure, which damages your blood vessels over time. The World Health Organization recommends no more than 5 grams of salt or 2 grams of sodium per day, but most people consume double that. Check food labels and cook more at home. Less salt today means fewer regrets tomorrow. High blood sugar silently damages your arteries. This makes it easier for plaque to build up, leading to atherosclerosis, a major cause of both stroke and heart attack.